Duke Endowment is one of the largest private philanthropic foundations in the United States, established in 1924 by James Buchanan Duke, an industrialist who amassed great wealth from the tobacco and energy industries. Based in Charlotte, North Carolina, the foundation continues to carry forward Duke's vision of supporting communities, advancing education, improving healthcare, and strengthening faith-based initiatives. With a legacy spanning nearly a century, the endowment has had a profound impact across the Carolinas, particularly in North Carolina and South Carolina. Origins and purpose. James B. Duke created the endowment as part of his will in December 1924, leaving a substantial portion of his fortune to establish a permanent trust. His intention was not only to secure the future of his business empire but also to give back to the region that had fueled his success. He outlined specific areas where the funds should be directed, ensuring that the resources would be used for charitable and educational purposes for generations to come. The foundation was designed to support four primary areas: higher education, healthcare, rural Methodist churches, and child care. Duke believed that addressing these core sectors would create long-term benefits for society and foster stronger, more resilient communities. His foresight has allowed the endowment to remain focused while still adapting to the evolving needs of modern times. Focus areas of support. Higher education. A significant portion of the Duke Endowment's resources supports colleges and universities across the Carolinas. Duke University, which shares its founder's name, is a major beneficiary, though other institutions such as Davidson College, Furman University, and Johnson C. Smith University also receive substantial grants. The endowment helps fund scholarships, faculty development, infrastructure, and innovative academic programs, ensuring that higher education remains accessible and of high quality. Healthcare. From its inception, the endowment has emphasized the importance of accessible and affordable health care. Hospitals, medical training programs, and initiatives that expand community health services have benefited greatly from its grants. Over the decades, the foundation has supported advancements in medical research, rural hospital development, nursing education, and community health outreach. Its funding has been crucial in improving health care facilities and ensuring underserved populations receive necessary care. Child and family well-being. Supporting children and families has been central to the mission of the Duke Endowment. Initially focused on orphan care, the foundation has expanded its work to include foster care, adoption services, and child welfare programs. It aims to create stable, nurturing environments where children can thrive. In recent years, the endowment has invested in evidence-based approaches that promote family preservation, mental health support, and child development. Rural Methodist churches. Recognizing the vital role of churches in rural communities, Duke directed part of the foundation's funds to support Methodist congregations across North and South Carolina. The endowment has helped sustain church buildings, provide pastoral education, and strengthen programs that serve local communities. By supporting these institutions, the foundation contributes to the spiritual and social fabric of small towns and rural areas. Impact over the decades. Since its establishment, the Duke Endowment has distributed billions of dollars in grants, making it one of the most influential philanthropic organizations in the southeastern United States. Its impact is visible in the strengthened infrastructure of hospitals, the thriving campuses of universities, and the growth of family and child services. The foundation has also been notable for its long-term approach to philanthropy. Rather than focusing on short-term relief, it prioritizes sustainable investments that bring about systemic change. This strategic vision allows the organization to address root causes of social challenges while maintaining fidelity to James B. Duke's original mission. Governance and management. The Duke Endowment is governed by a board of trustees responsible for ensuring that its founders' intentions are respected. Trustees oversee grant-making decisions, financial stewardship, and strategic planning. A professional staff manages day-to-day operations, conducts research, and collaborates with nonprofit organizations across the Carolinas. The foundation's strong governance structure has allowed it to grow its assets while remaining accountable to its mission. Adapting to modern needs. While firmly rooted in its founding principles, the Duke Endowment has evolved to address new challenges. In recent decades, it has expanded its role in public health, early childhood education, and social innovation. For example, it has supported initiatives to reduce health disparities, strengthen mental health services, and promote innovative teaching methods in schools. The endowment also invests in research and data-driven programs, ensuring its funding produces measurable results. A legacy of giving. Today, the Duke Endowment stands as a testament to the power of philanthropy guided by vision and purpose. It continues to shape communities across the Carolinas, touching countless lives through its support of education, healthcare, child and family well-being, and rural churches. The foresight of James B. Duke created not just a financial trust but a living institution committed to improving society for generations. Nearly a century after its founding, the endowment remains one of the most respected philanthropic organizations in the country. Its blend of tradition and innovation ensures that it will remain a cornerstone of charitable work in the Southeast well into the future.